Hi, I'm Dr. Brian Goldman, an ER physician, a medical broadcaster, and I'm back with another bit of hospital slang from my new book, The Secret Language of Doctors, in which I explore the mysterious world of made-up words used by doctors, nurses, and other health professionals to talk about the things we do looking after you. What's going on with the patient in room 1? I asked a nurse in the ER not too long ago. Not too much, she replied. Normal vital signs and no obvious distress. The nurse's face formed a sneaky little smile. Heads up, Dr. G. She brought a suitcase. My ears pricked up immediately. We call that bit of hospital slang the suitcase sign. Some call it the Samsonite sign, after the famous maker of luggage. Inside the hospital sliding doors, you'll also hear it referred to as the positive suitcase sign. The phrase mashes slang with a bit of authentic medical jargon to make it seem like genuine medical tech talk. In medicine, the word positive means the presence of an abnormal finding. For example, the urine dipstick test was positive for blood, which suggests that the patient has a kidney stone. Or the swab taken from the inside of the nose is positive, meaning that the patient has the flu. Suitcase positive means the patient has packed a bag. The reaction among emergency physicians and nurses to the patient who brings a suitcase ranges from mild amusement to profound irritation. To some of my colleagues, it means the patient thought he or she was sick or injured enough to make an unscheduled and unexpected trip to the ER, but despite the emergency, the patient had time to pack a suitcase. Or the patient may expect to be admitted to hospital, something the doctor or nurse believes is not going to happen because they just aren't sick enough to need it. A suitcase makes some doctors and nurses bristle because it's seen as an end run around them. It looks to some as if the patient is insisting that they be admitted to hospital. Many of us see that as a direct challenge to the doctor's authority to decide. When I was a lot younger, a suitcase really irritated me. Today, if I see a suitcase, I use it as a way to start the conversation with the patient about what they expect. I tell them that I can refer them to a specialist, but I can't make the decision to admit them. I've grown to like well-informed patients who know what kind of care they need. My aim is to leave the patient's bedside with all of us on the same team. But that's me. So here's my advice. If you expect to be referred to a surgeon, get an MRI, or be admitted to hospital, discuss it with your doctor or other healthcare provider, and be prepared to talk about it. Don't let a suitcase do the talking for you. And if you must bring a suitcase to the ER, consider keeping it out of sight. I'm Dr. Brian Goldman. If you liked hearing about the suitcase sign, there's lots more hospital slang in The Secret Language of Doctors.